Hello, my name is Anna Christensen. I am the Patient Science Liaison for Italfarmaco. Today I will share a review of the Italfarmaco Givinostat Development Program for Duchenne and Becker muscular dystrophy. I am an employee of a company called TRINS, a contract research organization. Italfarmaco has hired TRINS to help them connect with the community. Givinostat is in development for the treatment of DMD and BMD. It is not approved for sale anywhere. This presentation is intended to share scientific information with the community. Muscle cells repair themselves when they are damaged. When your muscle is damaged from common activities like too much exercise, the process begins. Your body sends signals to allow the repairs to start. When the repairs are finished, the muscle function is restored and the repairs stop. This process repeats every time your muscle cells are damaged. If you have DMD or BMD, this process doesn't work perfectly. First, the muscle cells are damaged more often because the dystrophin is missing or imperfect. Then the signaling that is normally used isn't working properly either. That means that the repairs are not done properly. Instead, scar tissue and fat cells accumulate inside the muscle. Scar tissue and fat cells prevent the muscle from working correctly. Givinostat is an investigational drug which is designed to activate the muscle repair process. For people with DMD or BMD, taking Givinostat would not change the damage being done to the muscle. Because the dystrophin is missing or imperfect, the muscle would be damaged more often. We are testing whether taking Givinostat would allow the muscle repair process to work more efficiently in people with DMD and BMD. We are testing whether taking Givinostat would reduce inflammation, increase regeneration, and reduce fat and fibrosis in the muscle. Next, I'm going to share some updates about the data we have about Givinostat in DMD and BMD. At previous conferences, we have shared mouse model data which showed increase in muscle fiber diameter, reduction in fibrosis and inflammation, and improvement on treadmill tests. We also shared clinical results from the phase 2 trial showing changes in biopsy results and muscle MRI after 1 year taking Givinostat. We have also shared that Givinostat has been used in more than 500 people who have different diagnoses, not just DMD and BMD. The safety profile shows that there are mild side effects such as reduced platelet counts, diarrhea, stomach pain, and increase in triglycerides. One important question is how taking Givinostat might change functional ability over time for boys with DMD. 18 boys who completed the phase 2 trial have continued to participate in an open label study and to complete functional tests. We have been comparing their performance to published natural history data to learn how their function may differ from boys with DMD who are not taking Givinostat. This slide shows the most current results for how walking ability differs between the two groups. On the left shows that boys with DMD in a natural history study lost the ability to walk in a predictable way. On the right, we see the 18 boys with DMD who have been taking Givinostat for over 6 years. We continue to see a delay in the disease progression. We now show an average age at loss of ambulation of 15.2 years among boys who took Givinostat. Among the natural history patients, their average age at loss of ambulation was earlier, 13.57 years. We conducted the same type of analysis for measures of breathing ability. In natural history studies, results show an annual 4 to 6% decline in respiratory parameters. Among boys with DMD who have taken Givinostat, we also see a reduction in disease progression in respiratory function. Boys with DMD who have taken Givinostat show a 2.3% yearly decline in FVC and no decline in the PEF% predicted values. Next, I'll share some updates about the clinical studies we're conducting in DMD. We are currently conducting a phase 3 clinical trial among boys with DMD. In the study, boys complete a screening process. Then they have a muscle MRI to measure how much fat is in a leg muscle. If all the test results are acceptable and if the family wants to continue, then the child attends a baseline visit. At the visit, the child is randomly assigned to receive Givinostat or a placebo, an inactive liquid that doesn't do anything. Neither the family nor the study team would know which group each child is in. This continues for 72 weeks. You can see that there are more frequent visits at the beginning of the study. That allows the study doctors to monitor any problems closely and adjust the doses as needed. Children also complete 2 more MRIs just like before. Once the study is over, everyone is allowed to enroll in an open label study where everyone receives Givinostat. We offer support programs to help families participate in the trial. We offer optional home nursing for the frequent or unscheduled visits. We offer central trial and travel support. Finally, we are offering the open label study to everyone who finishes the trial, regardless of their ability to walk. As with every trial, there are rules for who can and cannot participate. Boys ages 6 years and older with DMD who can walk, climb stairs, and get up off the floor may be eligible. Boys need to be taking a staple dose of steroids. They also need to be able to do an MRI. They also need to be able to do the stair climbing test consistently. There are several reasons why a child would not be allowed to participate. First, it is not allowed to participate in another clinical trial at the same time, to take idebenone, exon skipping, or premature stop codon read-through drugs, to take other drugs that affect strength and muscle function, to have ankle contractures, to need surgery soon, or are not healthy enough to participate. There are more rules listed on clinicaltrials.gov. Your doctor or your study doctor can review them with you in more detail. The clinical trial may include procedures that you've done before at DMD doctor visits. There are a few things that will be different. First, you'll fill out an informed consent form. That documents that each child and family wants to participate. Physical exams, heart tests, and breathing tests will be similar to what is done in clinic. The study takes blood and urine tests for safety and to measure how the drug is working. Boys and their parents fill out surveys and a diary. The functional testing will be slightly different from typical physiotherapy visits. Parents might not be allowed in the room, and the tests are more standardized. One test is to walk for 6 minutes. The North Star Ambulatory Assessment is a series of short tasks, like sitting up or standing on one leg. One test is to climb stairs. Another test is to push an arm or leg against a button to measure the force you make. Finally, children will complete 3 MRI tests. In these, the child lies down inside a machine that uses magnets to take a picture inside your muscles. In the study, boys will take the oral liquid suspension, either Givinostat or placebo, by mouth twice a day after a meal. Givinostat and placebo look and taste exactly the same. We have open clinical trial sites in the US, Canada, and Europe. We have enrolled 160 boys so far and hope to enroll everyone by the end of June. Recently, we completed an interim futility analysis. A futility analysis is a planned early look into a defined part of the clinical trial data. A futility analysis uses a small part of the study data to help decide whether an investigational drug is effective enough to continue in a clinical trial. This analysis was about the fat fraction in a leg muscle on MRI. The futility analysis compared the increase in fat fraction between boys who took Givinostat for 12 months with boys who took placebo for 12 months. These results showed that boys who took the Givinostat had a smaller increase in fat fraction than boys who took the placebo. We learned that the study was not futile. That means that the study enrollment will continue as planned. As you know, the coronavirus is affecting many aspects of life around the world. Families can still contact sites about screening for the trial. However, some sites may have paused enrollment due to local coronavirus activity. This may cause a delay in scheduling study visits. We appreciate everyone's patience during this difficult time. What happens after the randomized trial? Next, I'll tell you more about the open label study. The open label extension study is designed to learn about the safety and tolerability of Givinostat over the long term. In this study, everyone completes a baseline visit and then receives Givinostat. There is no placebo in this study. As with the randomized trial, there are more visits at the beginning of the study. This allows the study doctor to closely monitor for any problems and to adjust the dose if needed. The open label extension study is open to people who had completed a Givinostat study for Duchenne with no restrictions on walking ability. The study is open at sites in the US, Canada, Italy, France, Germany, Spain, Holland, and Belgium. We're opening sites in England, Israel, and Serbia in 2020. Next, I'll share an update about our clinical trial in Becker muscular dystrophy. This is a phase 2 clinical trial testing whether Givinostat preserves muscle and slows disease progression among adult men with Becker muscular dystrophy. The study objectives are to measure the changes seen from muscle biopsies and muscle MRI. As with the other studies, we are also testing the changes in the 6-minute walk test, the motor function measurement, and the North Star ambulatory assessment. To be eligible, men need to have Becker muscular dystrophy of any genotype, be between 18 and 65 years old, be able to walk 200 to 450 meters on the 6-minute walk test, and have preserved cardiac function. As with the other trials, this is a randomized, double-blind, placebo-controlled trial. After initial screening and MRI tests, patients are randomly assigned to receive Givinostat or placebo for 48 weeks. After the 48 weeks are finished, the patients stop taking the study drug and attend one follow-up visit. This study completed enrollment in February of this year. We have enrolled 51 patients and expect to have study results in the second quarter of 2021. If you have more questions about the trials I reviewed today, please visit clinicaltrials.gov and enter the numbers listed. You can learn all the details there. You can also reach our advocacy team by emailing us at patientadvocacy@italfarmaco.com. All of us would like to thank all the researchers, clinics, families, and patient advocacy groups around the world who have helped us with our research. Everyone has worked very hard to support the research, to collect the data, and to ask important questions. Thank you so much to everyone for your support.